Did you know that stomach cancer or gastric cancer is one of the most common cancers worldwide? In fact, it's the third leading cause of cancer-related deaths. But what if I told you that there are certain strange signs your body might be giving you long before a diagnosis? You might be ignoring symptoms that could point to stomach cancer, even though they seem harmless at first. Want to know what to watch out for? Stay with us until the end to discover the 8 unusual signs of stomach cancer that you shouldn't ignore. Early detection is key to improving your chances of survival, so knowing these signs can make a huge difference. Be sure to give this video a thumbs up and subscribe to our channel to stay informed about important health topics. Where are you watching from? Leave a comment below so we can connect. Feeling full after eating a small amount. One strange sign of stomach cancer is feeling full even after eating only a small amount of food. Normally, we feel full after eating a big meal, but if you feel full after just a little food, it could be a sign something is wrong. This might happen because cancer can make it harder for your stomach to hold or break down food. If this happens often, it might mean your stomach is not working properly. It could also lead to weight loss, as you may eat less because you feel full faster. If you notice that you feel full quickly after eating just a little, try to pay attention to how often it happens. Sometimes it's just from eating too fast. But if it keeps happening, it could be a sign of stomach trouble. This feeling can also make you feel bloated, uncomfortable, or sick after eating. If it happens a lot, you should talk to a doctor to make sure everything is okay. Unexplained weight loss. Unexplained weight loss is another strange sign. If you are losing weight without trying, it could be a sign of something serious. Stomach cancer can stop your body from getting the nutrients it needs from food, which can make you lose weight, even if you eat the same amount. You might feel weak or tired because your body is not getting enough energy from food. Weight loss can happen slowly, so you might not notice it right away. But if you lose a lot of weight quickly, you should see a doctor. Sometimes weight loss happens even if you are eating enough. This could happen because cancer is stopping your body from using the food properly. If the weight loss is not because of changes in your diet or exercise, it is a good idea to get checked by a doctor. Persistent nausea and vomiting. If you often feel sick or throw up without any clear reason, it might be a sign of stomach cancer. You could feel nauseous after eating certain foods, or just feel sick all the time. This might happen because a tumor in your stomach can block the food and liquids from moving normally through your digestive system. When this happens, food builds up, which can make you feel uncomfortable and nauseous. Sometimes the nausea is so bad that it can cause vomiting, making you feel even worse. Even if nausea happens once in a while, if it happens often or gets worse, it's important to pay attention to it. If you vomit a lot, it can make you feel weak and dizzy from dehydration. If the nausea and vomiting last for days or weeks without any clear cause, you should talk to a doctor and get the right tests done to figure out what's going on. Abdominal pain or discomfort. Pain in your stomach area can be another sign of stomach cancer. It might not always be very strong, but if you feel pain in your stomach area all the time or often, it could be a warning. The pain might feel dull, sharp, or like a bloating sensation. Sometimes it comes and goes, and other times it might stay for a longer time. As the cancer grows, it can irritate the lining of your stomach, causing pain or discomfort. The pain might also get worse after eating or drinking certain foods. Stomach pain can sometimes be confused with common stomach issues like gas or indigestion. But if the pain doesn't go away or keeps getting worse, it's very important to see a doctor. Difficulty swallowing. It might be a sign of stomach cancer. This happens because a tumor in your stomach can block the passage of food. If the stomach can't process food properly, swallowing can become harder than usual. You may feel discomfort or pain when you eat, and over time, this could make it hard to eat regular meals. This might lead to weight loss and not getting enough nutrients. At first, you might not notice difficulty swallowing, but if it gets worse and makes it hard to swallow food or even liquids, it's important to see a doctor. If this problem lasts for weeks or months, it could mean there's a blockage that needs to be checked. Black or tarry stools. If your stools turn black or look tarry, this could be a sign of stomach cancer. This happens when there's blood in your stomach, which mixes with food and causes the stool to turn dark. The stools might also have a bad smell. If you notice black stools, it's important to see a doctor right away because it could mean internal bleeding, which is dangerous if not treated. Black or tarry stools should not be ignored. It could also happen for other reasons, like taking iron pills or some medicines, but it's safer to get checked by a doctor. This sign, along with others, can help doctors find the problem early and act quickly. Heartburn or indigestion that won't go away. Heartburn or indigestion is common, but if it happens all the time and doesn't go away, it could be a sign of stomach cancer. These symptoms happen when stomach acid moves up into the esophagus, causing a burning feeling. If heartburn or indigestion doesn't go away with normal treatments, it might be linked to something more serious, like cancer. Over time, this can cause problems with swallowing or lead to weight loss. Constant heartburn or indigestion might be uncomfortable, but it's important to pay attention to it. If it lasts longer than usual and doesn't get better with medicine, you should see a doctor. Early treatment can help avoid serious health problems. Loss of appetite. If you suddenly lose your appetite and don't feel like eating, it might be a strange sign of stomach cancer. This can happen because the cancer affects the stomach's ability to tell your brain you're hungry. Without these hunger signals, you might lose interest in food, leading to weight loss and weakness. If you don't feel hungry and it lasts longer than usual, and it's not caused by stress or being sick, it's important to talk to a doctor. They can help figure out the cause of your lost appetite and whether it's related to stomach cancer or another problem. While these signs could be linked to many other conditions, it's always important to listen to your body. If any of these symptoms sound familiar, don't wait too long to seek medical advice. Early detection of stomach cancer increases the chances of successful treatment, so getting checked out is always the right step. Remember, a healthy diet, regular checkups, and maintaining a balanced lifestyle can play a big role in cancer prevention. Have you experienced any of these symptoms? Let us know in the comments below. If you found this video helpful, type yes in the comments, and don't forget to check out the videos we've selected for you. Thanks for watching and take care of your health.